Well, today is June 29th, 2016. Kay Wagner is talking with Dr. Stephen Copps, Sr., a retired pediatrician. Dr. Copps received his MD from the University of Colorado in 1958, followed by residencies at Denver Children's Hospital and the University of Wisconsin-Madison. Dr. Copps joined Gunderson Health System in 1961 and left in 1992 to become associate professor at Mercer University School of Medicine in Macon, Georgia, and director of the Central Georgia Institute for Developmental Medicine. His tenure at Gunderson was 31 years. Welcome, Dr. Copps. We're pleased to have you here.
Well, it's certainly good to be back.
Well, we appreciate your time. We'll start with some questions about your background. You're from the Marshfield, Stevens Point area, is that correct?
Stevens Point
Okay.
was my home. Marshfield, I was born because they rushed me over there because my Lyman Copps was the supervisor at the Marshfield Clinic at the time, so they got me over there in time.
And your family was in the grocery business?
Yes, yes.
Talk about that and your family history and growing up.
Well, there's the Copps Company started out as a wholesale coal company, and then they got into fruits and vegetables, and then that just that expanded, and then they started these supermarkets all over the state, Copps supermarkets. And
Sure. Did you have siblings?
yes.
How many?
Well, I have three living. I had a daughter that died
Oh,
of a horrible infection when she was 40 years old. But so there's Steve, who's here and works in the emergency room, and then Chris is in California, in Laguna Beach, California, and and then please excuse me. And then my other son is in North Carolina, Greg.
and grandchildren?
Oh, yes.
Yes. Do you get to see them often?
Well, a couple have been here just recently, but no, not often, but I have several.
Yeah. Besides what I've talked about, describe your education and training and how you decided to become a physician.
Well, I was about 6 years old.
6 years
when
old.
I decided. And I think a lot of that had to do with my uncle Lyman, who is the head of the Marshfield Clinic. And I would go over there and visit. And then my best friend's father across the street knew I wanted to be a doctor, and he'd take me to surgery with him. And so I never thought of anything else. I wouldn't have been anything else.
Really? What,
I'm glad I did.
I have down too that your uncle Lyman Copps was a physician at Marshfield. And that it sounds like that influenced your decision to become a physician as well.
Yes, yes,
And the neighbor that took you to
yes.
watch surgeries.
Yeah.
How did you first hear about Gunderson?
The Gunderson Clinic? Well, I was offered a position at the university, and they were having kind of a tough time between how much they had to write and how much they could do, and so I decided to look around, and I think I saw an ad someplace, and I called here, and they asked me to come, and I came, and they wanted me, and I was with Ralph Slungard and Per Helgeson. It was funny, a lady called one time, and she said to the receptionist, I want the doctor that speaks English.
Oh, what impressed you about Gunderson when you were here?
Everything. it was a different Gunderson. I mean, we had the Saturday morning breakfasts, and it's just it was terrific. It still is, but in a different way.
Mm-hmm.
But I don't know, there were 47 positions here when I came or something like that.
What was your number?
I don't know, but something like 47, 48, something, or more, but somewhere there. But I was just impressed by the quality of and I was really impressed by the vision, because even then, and we had just that one building and all that, and it was it was right after the fire,
Mm-hmm.
just a little time after the fire.
61.
And I told them I wanted to come, and they called and said, "Well, we want you," and so I came.
That had to be an interesting time.
Yes, it was fascinating.
As one of the first non-Gundersons, did you find it challenging to be in practice here?
No.
No?
Well, challenging, yeah. I mean, I love medicine, but I had no problem with the Gundersons. I love the Gundersons. I mean, and they were very good to me. And when I started the Comprehensive Child Care Center, Adolf was a very great help. In fact, he took my learning disability specialist and he started a school for learning disabilities. Mm-hmm. Yeah.
Yes.
And he took my learning disability specialist, and I offered him her. She was very good, and she was my first learning disability specialist.
You were an advocate for communication with the child as a patient and created an atmosphere that served that purpose. Tell us about your philosophy.
Well, it's so funny because my son now is in emergency medicine, and one of the things I said is listen, and I like to talk to my patients, and the mother would often intervene. And I said, "I'm talking to Johnny right now," and she said, "Oh, okay." but I did, and I talked, no matter their ages. I helped them understand what was going on.
Mm-hmm. How has pediatrics changed over the years? What do you see as the biggest innovation in that field?
Well, I think the clinic has changed over the years, and it has to. You're in a buyer's market. But the interesting thing to me is when I'd be traveling, I did a lot of traveling, and the people say, "Oh, where were you?" And I say, "The Gunderson Clinic," and they'd say, "Oh, that's a great place." Well, no matter where you were, really, it's got a wonderful national reputation.
Mm-hmm. Well, you really grew the pediatric program in interdisciplinary, regional, and visionary ways. Many firsts happened. You have a list of the first this, and very many positive things happened during your tenure. Share some of those accomplishments with us.
Well, the best thing I ever did was start the Comprehensive Child Care Center, and that got a very good reputation. I saw patients from 20 different states and 4 foreign countries. They even came from Japan and I don't remember the other, again, Canada. But the idea was in the Comprehensive Child Care Center that I got an excellent staff together, and then we met, and then we decided what was going to be said. And I would listen to them, and I may say no, or I may say yes, or I may say that's a great idea, I never thought of it. But we always met, and so that I spoke in one voice, so you didn't have 8 different doctors telling you about your child. That's a mistake
Mm-hmm.
you made. And then the university came, Irene Eibler came and studied this process for a while, and they built the same thing at the University of Wisconsin. And then Mayo wanted it. Well, I went over to Mayo. They asked me to come over to Mayo, and I met with them, and I said something about this. So we'll start one of these in Florida and our place. And I said, you ever think of Olmsted County? And the other thing is that I finally, academic freedom is not the freedom to ignore the person across the hall. But now Mayo is doing exactly the same thing.
Took a while.
Yep, it did, but they are. It's the same concept. Because I visited Mayo several times. I had some friends there, but and it was there wasn't a very good contact between the physicians, and then how they spoke to the patient, and so you had it. But it works out very well this way, I think. A little prejudiced.
You also, you just talked about that, but you also established, at the encouragement of the executive director of the United Cerebral Palsy of Wisconsin, a center as well, which later expanded into the Neurodevelopment Center, and then even further into the CCC, Comprehensive Child Care Center, correct? So it.
Yeah, I was on the state committee for developmental disabilities for several years.
And you mentioned the different countries and the states. What was one of the more serious afflictions with developmental disabilities during your tenure that you saw? And has treatment for that improved?
Well, I think the acknowledgement of the importance of treatment is the most important thing, because so many people would just kind of hold their hands up and say we can't do anything. And my point was, there's nobody you can't do something for. And it was really interesting to me, because I would see these children with really bad disabilities. And I realized that you've got to have someone visiting the homes and the schools of these people. And I managed to get money from 6 counties. And I have send the people out to the homes and the schools so that they could see what's going on. And that was, and all of the counties were very pleased with what I'd done. And I started with a grant from the university of $10,000 or something like that.
Also, during your time at Gunderson, you were a member of Governor's Task Force and medical consultant to the La Crosse County Board and Director of Cholita, among many other community involvements. What are some of your favorite memories from your community involvement?
Well, I love Cholita. Then I got involved with over in La Crescent with the program there, and I just very much enjoyed building.
Mm-hmm. And you also directed the pediatric residency program for 10 years.
10 years. Yeah.
How many years was that residency program here? Was the length of it?
Gosh, I don't know. I mean, I'm sad it ran out, and it should be reestablished. And I'm upset. I talked to Jeff about it before he left. He knows it, that it hasn't been reestablished, because you've got so many good programs now, and you don't have a pediatric residency, and I'm so glad you got a family practice residency now. Mm-hmm. But someone, hopefully, would have enough guts to get a pediatric program going again, because it's the only major specialty that's not covered, and right. That's a big, big mistake, I think.
Well, 10 years was quite a long time. I don't know the exact dates either of how long it was here. I don't remember it being here when I came in 85, but some others that we have interviewed that are pediatricians also express the same, the same regret at seeing the residency have to go.
Yeah.
You generously give much credit to your office manager, Bonnie
Oh,
Ritter,
yes.
and her assistant, Kayla Haug. How did they enhance your work?
Oh, tremendously. We were the first places in the clinic to have a computer system, the first ones. And every once in a while, I would say something, and Bonnie would say, "I don't think you should do that." And I say, "What?" And I'd think for a while. I said, "Yeah, I think you're right." But she was tremendous. And then I got from the Kiwanis Society money to start a toys lending center for children. And so I put Kayla in charge of the toy lending center. In addition to being Bonnie's assistant, she was wonderful in that. And then we'd loan these toys, and they'd have to bring them back, but at a certain time. But it was great. There were a lot of people that had toys where they never had toys before. So, toy lending center was a neat idea, I think.
Kayla's got a lot of energy.
Kayla has a lot of energy. She's well, the two of them. We meet every year. The two of us. Well, my wife and the two of them, and myself, and recount the olden days, the good olden days.
Did anybody else provide support during your tenure at Gunderson? Anybody?
Oh, the Gundersons did. I mean, and what I said is Adolf started that learning program, for example, and yes, I got excellent support. And then I got Paul Summers. I stole him from Oshkosh, and that was a real boon. And I mean, not Oshkosh. Marshfield.
Marshfield.
And they were not happy, but he was wonderful, and he was my learning specialist. And then he was a very good administrator, and so the administration picked him up, and he was the assistant administrator. And then he had an offer to go to Minneapolis, and he oh gosh, I can't think of the name of the hospital, but the major hospital in Minneapolis. He became director. So he was, and we were very close for very long. I've been trying to get a hold of him, and I can't. I had gone here, and first I've lost contact with him for the last 10 years or so. But he was terrific.
How did your experience here differ from, or was alike, your experience at Mercer?
Very different. Now, I was very fortunate at Mercer. They gave me everything. I mean, they gave me a beautiful building and any staff I wanted. But the whole medical system, we had some very good physicians. But for example, if a person went to a physician and there was something that needed the attention of a different physician in a different practice, then they'd send them over to that physician. But what they would do is then they'd call everyone a new patient. I mean, to give you an idea of what it was like. And we did. We had some excellent doctors, and we had some real bone doctors. I mean, not so hot. But there was no correlation. I mean, there's nothing like the clinic.
And how many years were you there?
Oh, well, I came back 3 years ago, and I left in 92. I think it was 92.
Did you enjoy living down in that part of the United States?
Well, I enjoyed it. My wife was from there, and yeah, I really enjoyed it. And I think if I hadn't been through that divorce and all the other things, and hadn't met her, I never would have been there. But they treated me. They were just wonderful to me, and I couldn't complain. They gave me everything, and I saw patients from all over that part of the country.
And it was more of an academic environment as well,
Yes,
probably. Yeah.
yes. Yeah, I was a teacher.
Well, and you've also received several prestigious awards, including the American Academy of Pediatrics Award as the state's most outstanding pediatrician. How meaningful were these awards for you?
How many what?
How meaningful?
Oh, yes. Oh, yes, yes.
Can you describe some of the other ones?
Well, I got an award from the University of Wisconsin as an outstanding physician. And, I got some others. I can't remember them.
Yeah, I had them down too, but I was just wondering if there was one that stood out in your mind as your most meaningful, the one that meant the most to you.
Well, I think it wasn't really an award. What meant most to me is to be the National Committee on Developmental Disabilities. That was the most meaningful thing to me. And then they made me director of training of residents, interns, and medical students and residents in developmental disabilities and different. So I traveled to all the medical schools all over. That I really enjoyed.
All over the
country.
Mm-hmm. And what has, in your opinion, has been the advancement of treatment of medical disabilities and pediatrics in general over the past 20, 30 years?
Well, I think the most important thing is recognizing that there's nobody that there's not help for. I mean, you can help anyone no matter how severe their disability.
Has technology also helped the whole specialty to grow at a more rapid pace in terms of?
Yes, in a way, but there's not a lot of technology outside of your head. I mean, in that, because we're not talking about surgical procedures or diagnostic procedures as far as instruments and things.
Mm-hmm.
So, I don't know.
Well, you are a supporter of the foundation and an advocate and an active attendee at the Emeritus Breakfast.
Yes.
Tell us why you contribute and remain active in foundation
Well, I love the
activities.
Gunderson Clinic, and if it hadn't been for the circumstances I told you about, I would have stayed there. But I know I love the Gunderson Clinic, I really do, and it's interesting to see how it's evolved. And I remember, and in some ways, though, it's gotten, I don't want to say too technical, but I have a lot of medical problems, and I'm here probably at least once a month or something. And some of the people I see just sit at their computer and just tap away. And but I've had some very excellent physicians too, but I've had a lot of problems.
That's
I'm glad I'm here, though.
Mm-hmm. The other people that I've interviewed also talk about the interaction with the patient has become a little less impersonal because you're
Yes.
having to type the
Yes.
notes in.
Yes.
And so you've got your head turned away from the patient.
Yes.
But
Yes.
I guess that's part of technology, so to speak.
Yes, it's part of technology, but it's part of the person too. There are ways of. I have some physicians that are very, very good. The other thing is that I think we're finally coming to recognition. You don't need 4 years of medical school and 5 or 10 years of specialty practice to realize you do a lot of things in medicine. So we're finding a lot of wonderful people that are not physicians, and we'll see that more and more. Then we have the other problem of the extremely high priced. I mean, they're really high priced, but in order to compete on a national basis, you have to have them. But I think we're seeing that PNAs can do a pretty remarkable job, and you don't need all that training to do a lot of what medicine does.
Well, and pediatrics was the first department to employ a nurse practitioner.
How well I know. I started it.
Yeah. So that was a real
I got
milestone.
and then they came to my program. The nurse practitioners here came down to Georgia to the programs I started down there. That was kind of fun.
I think a nurse from Colorado actually had started the idea or had done some research on nurse practitioners as part of the team.
Yeah.
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 Thinking back.
Well, we'll see more and more of it too. Yeah. We have to.
Well, and as you listed on your resume, you had quite an interdisciplinary team in various fields.
Yeah, 8 different fields. But we put it together. That's where where it really matters.
Well, thinking back to your tenure at Gunderson, what would your colleagues say that you're known for?
I would think the Comprehensive Child Care Center.
And what would you really like to be known for?
Well, I think the Comprehensive Child Care Center was probably the most really good thing I did.
You mentioned a particular patient, Peter Niwala.
He was one of my favorite patients.
How did this annual visitor come about?
Halloween. There's Halloween, and I had to do something at Halloween. So I decided to admit a pumpkin to the hospital. I called him Peter Niwala, pumpkin spelled backwards, and he was from Hill 4, Row 5, Nick Pump, Iowa, which is pumpkin spelled. And it was really interesting, because then what I would do is I would send out requests for these different specialists to come and see. I'd say, but I have some difficulty with this patient. I'd like you to come, and it was really fun to see the different results. I mean, one is, I won't mention his name, but was just disgusted with why would he do so. He was not one of my favorite people, but most of them just got a big kick out of it, and they kind of broke up the day and broke up the whole thing. Oh my God! I think one of the funniest, I might have told you this, that Nancy Bowl was our nurse, and she was a jewel, and she got this. Did I tell you that she got this phone call from the administration? I told you that.
Yeah, but go ahead and
I told you that.
And tell us about it on tape, because it's a classic.
she got this call from administration, and they said, "We understand that you have a patient there whose parents haven't registered. His name is Niwala." And she said, "Yes, we do." And she says, "But his patients have to register. You send his parents have to register. You send his parents down right now." So she did. She sent down Peter Niwala and
Witch Hazel.
Witch Hazel was.
That is funny. And then, did you pull this on some of the med students or the residents? I mean, if they knew about it the year before, you had to find new people that wouldn't suspect.
Yeah, but they all knew about it. This was for the staff, the new staff.
The new staff.
And most of them were just, oh my God! But most of them really enjoyed it, and it kind of broke up the seriousness of the profession.
And Peter actually had his own chart, I think, too, didn't he?
Peter had he was a pumpkin.
But there was a chart. At least I thought that's what
Shirt.
Elston said.
A shirt.
A chart.
Oh, chart. Oh,
chart,
yes.
yes.
Oh, God. And then you read the chart. You know, run in the the IV fluids at 4,800 drops a minute, and I mean, wild stuff. And they'd look at it and say, "What in the hell is this?" It was fun.
Oh,
It was
that
fun.
sounds like fun. Any other special memories, good days, bad days?
No, I had very good days. Good days here. I mean, I love the Gunderson Clinic. I really do, and I think Jeff did a wonderful job too.
Any advice for medical students that are considering the practice of pediatrics?
Well, I could tell them how much I liked it. As long as you talk to it was so funny when I start talking to the children, the mothers would intervene. I say, "No, I want to talk to Johnny." But I enjoyed talking to the children, and I think the parents really appreciated it too. But I thought it was fun. I love medicine. I really, really love medicine. I have since I was 6 years old.
How do you develop a dialogue with a child, especially a young child? You must have gotten really good at that, so that the child can understand.
You ask them simple things like, "Do you like football?" or "What do you do for this?" or "What do you do for that?" It's just easy to develop a dialogue with them.